disoriented and slurring his speech.
Phipps, do you know where you are right now?
I go to San Jose State University.
He is disoriented, but no longer slurring.
It was worse before.
Okay, squeeze my fingers. Right side weakness.
We should prep a bolus dose of TPA.
No, we should not do that. Can you wiggle your toes?
But if he's having a stroke...
His speech is improving, which makes a transient ischemic attack more likely, and you ordered a nurse to prep an unindicated and very risky medication.
I didn't order her, I was just making a suggestion.
Get out!
What?
You refuse to acknowledge you made a mistake which wastes my time and endangers our patient. Please leave the patient's room now. We need a head CTA to confirm it's a TIA and not a brain bleed or tumor. Checking pupils.
Are we going in for a head CT?
Doctors Walk and Kalu are.
You shouldn't have raised your voice to me like you did.
I spoke with an urgency that was appropriate to the situation.
It may be appropriate to some, but as a person on the spectrum, I don't do well when shouted at.
I did not shout.
I'm letting you know the parameters for communicating with me effectively. I'd appreciate your cooperation. I'll go join Doctors Wolk and Kalu.
No. You will go to the skills lab and study stroke protocols and procedures for handling a TIA.
I didn't do anything wrong.
Bringing up the last attachments to the liver.
Using ultrasonic coagulator for hemostasis on the cystic plate? What about an atypical presentation of lupus?
And an ESR all normal.
That's why I said atypical. I mean, what else could cause symptoms in the esophagus, brain, and gallbladder?
Dr. Kalu, please irrigate and bleed the wound closure.
Have vicral sutures on a long needle driver.
Can I feel it? Sorry, I know I'm not supposed to be talking, but I've never felt a live organ before.
It needs to go to pathology, and please don't distract Dr. Kalu.
Oh, she's not distracting me.
It's just gonna sit in the pathology fridge for a few hours anyway.
Do it quietly.
Thank you, Dr. Murphy.
Sponge here so I can see better. Need another ovicral suture.
And I'll take the Metzenbaum scissors.
That's enough. Put it back now.
Wait, just give me a... Ow! I think a needle got left in the organ.
That's not possible. We never suture inside the gallbladder.
I know, I felt it. Ow, okay, there is something sharp in here. Maybe it's an edge of a gallstone?
I'm coming. Okay. There is something protruding. Small forceps?
Is it a hair?
Oh. It's a metal wire. We need the strongest magnet we have. Stat.
What are you gonna do with that?
It may be slightly painful, but it's much safer than another surgery. Open wide and say, ah.
That was in my tonsil?
Yes. It caused an infection and fluid buildup in your ear and irritated your carotid artery, which caused the neurological symptoms. You shouldn't ever clean a cooking surface with a wire brush, or let someone slap you, or shoot you with a foam shotgun slug.
That is so cool.
Yes, it is.
Cameron Howard, 38, drove his car through the back of his garage. BP is stable.
Stat trauma panel labs and an EFAST.
Whose garage?
Our garage, Cam. He just, forgot which was the gas and which was the brake. And also that he's not supposed to drive.
Who said I'm not supposed to drive?
Your doctor. He's been diagnosed with early onset Alzheimer's.
At 38? That is so young.
He's tachycardic and hypotensive.
He is in hemorrhagic shock.
What?
Pushing a 500cc bolus. Call the OR, we're on our way.
Cam's Alzheimer's is so atypical. Given his age and the rate he's declining, I just think it's worth it reconsidering all treatment options.
There are no viable treatment options, so it is not worth reconsidering.
How about vagus nerve stimulation?
Nice.
It hasn't been tested for early onset cases. Not viable.
Focused ultrasound.
That may stabilize the plaque burden, but would not improve clinical symptoms. Not viable.
Deep brain stimulation at this moment.
Highly invasive with limited efficacy. Not viable.
What about non-invasive deep brain stimulation using temporal interference?
Stimulating the hippocampus could improve episodic memory.
So valuable.
Yes.
Right. Nice.
Hi, Julie.
Hey.
I'm so sorry about this. I know that I'm slipping. You have to put me in a nursing home. And I do not want you to use our savings. It's got to be a place that our insurance will cover.
No, I can't.
You have to. Julie, it'll be too much to take care of both of us, okay? You have to, Julie, for our baby, okay? Okay. Why am I in a hospital? What's wrong with me? What is happening?
It's okay.
I don't, oh my God, what's happening? What's happening to me? Oh my God. Why is this happening to me?
His numbers all look good. We can discharge him tomorrow.
We always wanted kids. He couldn't wait to be a dad. Then I got diagnosed with breast cancer, stage 3, really aggressive. I was so sick. And Cam, he took a leave of absence so that he could be with me every miserable hour of every miserable day. And that wonderful man is still in there somewhere. If I try to look after both of them, I won't be enough for either of them. I'm gonna terminate my pregnancy.
I'm sorry, but this is not like old times. It's not just the tequila and the music that's changed. Everything has changed. How I see the world, how I see you, how I see me. One teeny tiny little baby and the whole world looks different.
I should go to the hospital.
You go to the hospital, I'll go home to Steve.
Okay.
I got your ultrasound set up on his left side.
Okay, I am testing a theory. Wake up, please. What are the words we asked you to remember?
What are you doing in my house? I'm calling the police. I don't...
What are the words we asked you to remember?
Apple, elephant, planet, and table.
What just happened?
His Alzheimer's is atypical because it is not Alzheimer's. His left jugular is compressed and restricting blood flow from his brain, which is only restored when his head is turned to the right at least 60 degrees. There definitely is a viable treatment option. A surgery. I will tell your wife.
That guy's good.